Welcome to the third episode, Bringing Sunlight to Mental Health. This channel aims to raise awareness of mental illness in the hope of promoting open conversation and reducing stigma. Open conversation is more critical now than ever before. Developing awareness helps us to recognize the signs and symptoms and makes it easier to find treatment. In this episode, our consultant psychiatrist, Dr. Tomboya, gives a general overview of mental illness. In future episodes, he will delve more on specific types of mental illness. Ensure that you stay tuned to this channel.
Dr. Tomboya, Nyangwara. I'm currently working in Kisumu County, Department of Health, as the medical superintendent for Kisumu County Referral Hospital. Apart from that, I'm also a consultant psychiatrist who is consulting for Kisumu County. We'll briefly talk about mental health. It's become a challenge that's affecting quite a number of people. Regionally, globally, the numbers keep on increasing. According to WHO, mental health is defined as a state of well-being in which an individual realizes his or her own potential, is able to cope with the normal stresses of daily life, and is able to be productive or work productively and fruitfully, and at the same time should be able to contribute to his or her community. So basically that is how we define mental health. In the absence of what I've defined, if a patient, this individual is not able to cope with the normal stresses of daily life, is not able to be productive and be fruitful in his community or in his daily activities, and is not contributing to his or her community, then that defines what mental illness is. Looking statistically, it's been reported that 1 in 4 individuals, if you meet 4 individuals, 1 out of the 4, one of them actually it could be having a mental illness. So the statistics actually has been increasing. We have cases increasing, number of cases reported as being depressed. Others have psychotic disorders. Others have anxiety disorders, and quite a number. We also have the childhood disorders, which probably we might not be able to cover as at now, but there are quite a number of cases that we also see in children. So basically I would probably maybe divide mental disorders that we see in our facility in terms of the ones that are affecting children. So there are those that affect children, and an example that I would probably give is ADHD, which in full means attention deficit hyperactivity disorder. We see quite a number of them cases in our day-to-day practice. We have autism spectrum disorder, which is also common. Others which you might also be able to see, we have learning disability or learning disorder. So those are also quite common. So in the absence of the children and adolescents, also those are the cases that we see. Then now we have women, which also have got a number of disorders that can also affect them. For those who are pregnant or after delivery, we have postnatal depression, which is common. We have postnatal psychosis, which is also there. We can also have anxiety disorder that's also present in mothers who are pregnant or after pregnancy. So we also see a number of those cases. Yeah, then now we have the general adults. Under general adults, that now cuts across both women, ladies, and gentlemen, or men, women. We have psychotic disorders. Under psychotic disorders, the one that is more common that I would probably highlight is schizophrenia. Yeah, so that is one of the psychotic disorders that we see. We also have brief psychotic disorder. When we talk about brief psychotic disorder, this is a psychotic disorder that presents within less than 1 month. Yeah. So if it presents within that duration, then we talk about brief psychotic disorder or brief psychotic episode. If it presents between 1 month and 6 months, then we have a term that is used to call that, referred to as schizophreniform. Yeah, and then after 6 months, then now that's when we talk about schizophrenia. So apart from the psychotic disorders, we have the mood, the mood disorders. So under mood disorders, we have bipolar mood disorder. We have major depressive disorder. Yeah. So under bipolar mood disorder, bi basically means two. So how it presents is that the mood could be labile. It changes. Sometimes they have low mood, sometimes they have elated mood, you know. Yeah. Sometimes you have a mixture of both. Yeah. So our bipolar patients, especially the manic type, presents is that I've talked about the mood, which could be low, could be elated. They are easily distracted in the activities that they do. Well, could we engage them in an activity, within a short time they shift from what they are doing to another one. Yeah. So they cannot consistently concentrate in one activity that they are doing. Yeah. They lack sleep, what we refer to as insomnia. Yeah. So literally for even 3 days somebody is not able to sleep. Yeah. They're just awake, talking, excessively, Yeah. They could be irritable. There's that irritability that actually is not normal. Yeah. Yeah. And then sometimes they have grandiosity. Yeah. Yeah. This self-esteem, they feel they are important in the society, they know important people, Yeah. Yeah. They relate to important people, they have special powers, they can talk to God, they can talk to Jesus, get command from Jesus, God, Yeah. Yeah. So we see that a lot in those who are bipolar patients. Yeah. They also have flight of ideas. So when you engage them in a conversation, they move from one topic to the other. They shift from one topic to the other. Yeah. So flight of ideas. Yeah. And then we have increased activity. In increased activity, this is one person that can, when they engage in an activity, they don't get tired. They can work from morning to evening. If it is sweeping, somebody could sweep from morning to evening, consistently just sweeping. Yeah, Yeah. They can wash if it's clothes. They can start washing from morning to evening without getting tired. Yeah. So you find that they have increased activity. There's that energy, extra energy that they have that they can make them perform, an activity from morning to evening without getting tired. So that is an activity, that's also a symptom that you are able to see. Yeah, then the other thing, we also see the speech. That's what we refer to as pressured speech. So basically is that they talk too fast and loud. Yeah, yeah. There's the normal way of talking, but you see this patient that, they just talk, keep on talking. Yeah. So we see that a lot also in bipolar patients. Then we have what I refer to as thoughtlessness. What do I mean when I talk of thoughtlessness? These are people that can engage in risky activities. Yeah, it could be risky sexual activities. They can go with any person. Yeah, they can sleep with anybody. Yeah, so we see this a lot. So these are some of the things that when you notice, then you want to intervene first so that they don't engage in those risky activities which might bring problems. Yeah. So apart from that, we have these are people that can spend. Yeah. You give them money, they have 1 million, they can even give freely. And we see this, yeah. You feel somebody gets money and they just give. You ask and they give. Sometimes you don't even ask. They go to a supermarket, they buy things that they had not even planned to do. Yeah. Yeah, so we see that a lot in mood disorder. So that's what just the other symptom amongst the mood disorders is the major depressive disorder, what we refer to as depression. Yeah, and the numbers actually are increasing. Yeah, there are a number of factors that can contribute to that. Yeah, so in depression, so what can you notice in somebody who is depressed? One, the mood is low, consistently. They have low mood, yeah. You know, they're just sad, you know. Yeah. So that's one thing that you can see in patients who are depressed. The other thing that you can also notice is that they can sleep excessively. Yeah. Yeah. You know, somebody just want to sleep. They don't want to get out of bed. Yeah. Yeah. Or at night they don't get sleep at all. Yeah. Yeah. So then the other thing is that there's lack of interest in the things that they used to enjoy. Yeah. Somebody probably used to like jogging, you know, yeah, or singing, you know. All of a sudden now you notice they no longer have interest in those activities. Yeah. Yeah. So that is one. The other thing that you can also, there's also the guilt, or what sometimes you see as worthlessness. They feel as if the world has no meaning to them. Yeah. Yeah. They are not worth living, you know. Yeah. So this is one thing that you also notice. The other thing is this low energy. They are lethargic, you know. They are slow. Yeah. Yeah. Under normal circumstances, when you wake up in the morning, you are full of energy. You want to face the world and go and work. Yeah. But this is one person that is now lacking. They are sluggish. Yeah. Even when they wake up in the morning, getting out of bed to go and start doing something, an activity, will take them even 1 hour. They just sitting there contemplating whether to go or not to go. Yeah. So the other thing, there's also poor concentration. They don't concentrate in anything that they do. Yeah. So that's also common. Yeah. The other thing that you'll also notice when they are slow, yeah, there's psychomotor agitation, retardation. Yeah. When they are conducting or doing an activity, they are slow in performance. Yeah. They don't perform actively as they used to do. Yeah. Then lastly, we have suicidal ideation. So we see this a lot in depressed patients here. Yeah. So when we do an assessment, then this is one of the things that we always ask. Yeah. Do they have those recurrent thoughts of taking their own life or harming somebody? Yeah. So that's a question that we always ask to screen for it. I didn't mention that even in the bipolar patients, they also get suicidal ideation. Yeah. Then they can easily hurt themselves or kill themselves. Yeah, or die by suicide. Yeah. So those are two conditions that I've mentioned. So then we have the anxiety disorders. So the anxiety disorders, there are quite a number. Yeah. Yeah. So anxious patients, what you notice that they worry over so many things. Yeah. Yeah. They worry over this, they worry over that, they worry over this, you know. Yeah. Then apart from worrying over so many things, yeah, the other thing that you notice that there are also symptoms that they can also present with the physical symptoms. Yeah. The heart might be racing too fast, heartbeat, increased heartbeat, you know. Yeah, so that one you can also, they can sweat, you know. Yeah. They just sweat. Yeah. Yeah. So those are some of the things that you might not notice in somebody who has anxiety disorder. Yeah. Yeah, then the other one of the anxiety disorders are again, so there's also the panic attack or the panic disorder. Yeah. So these are intense panic. Just happens within a short time. It doesn't last for long, maybe for about 10 minutes, 5 or so. Yeah. Yeah. But apart from that, as if there is an impending doom, that something wrong is going to happen. Yeah. It just gets you just all of a sudden. Yeah, it happens in a flash. Yeah. So apart from that, at that particular time, this person will be sweating. You know, the heart will be racing. Yeah, so fast. You know. Yeah. Yeah. Then within a short time, then it stops. So that is how you can differentiate that from anxiety disorder or the generalized anxiety disorder. Yeah. Yeah. Then apart from the anxiety disorders, there are other mental disorders that we also have that can present in the general adult population, yeah, including substance use disorder, which again now is becoming a big problem, and not only in the Western world. We are now seeing young people getting involved in in use of substance. Yeah. Like in Kisumu, for a long time we didn't have heroin, but we are starting to see that in the patient that we are managing here. Yeah. And the worst is the younger generation. The other condition that we see in children that I didn't mention is conduct disorder. Yeah. These are children that have disregard for law. Yeah. They infringe on people's rights. Yeah. You find a child that is constantly, they just either they beat other children, yeah. They just want to make other children feel pain. Yeah. They steal their stuff, yeah. Stealing, they lie a lot. Yeah. They lie to you a lot. When you notice that, then that is consistent with the conduct disorder. And sometimes we don't go behind to find out the reason why they do that. Yeah. There are factors that could be doing that. Yeah. There is what we refer to as dysfunctional family, which actually is contributing a lot to this. Yeah. When parents separate, most times we make decisions amongst the two adults, but you don't consider the children. Yeah. So this affects these children, and since they are young, they are vulnerable, they cannot express their feelings, so they end up now starting involving themselves in this, manifesting with the conduct disorder, or even engaging in substance use. Yeah. So those are some of the factors that lead these children into engaging those activities. Yeah. So gambling, by the way, is now considered a mental health disorder. Yeah. And so many youth are involved in this, and they can do anything. They can steal to get money to go and gamble. They can sell whatever they have. Yeah. So gambling is also becoming a challenge, yeah? And it's also regarded as mental disorder. Then the other thing that I didn't talk about amongst the anxiety disorders is the post-traumatic stress disorder. Yeah. So this is a person that is, has been exposed to a traumatic event. Yeah. Traumatic event in the sense that maybe you've seen somebody being shot. In your presence. A girl probably has been raped or defiled, These are conditions that can lead somebody to. Yeah. And the police officers, most times when an accident happens, the police officers are the ones who go to collect the dead bodies. Yeah. You can imagine if you are exposed to this over and over again. Yeah. We do see police officers or even the army. Yeah, presenting with post-traumatic disorder. Yeah, there's a case that I've been following up for about close to over 1 year. Yeah. Who presented with post-traumatic stress disorder. Yeah, and it's a very difficult condition that if you are not good at managing it, then it can have devastating effects on an individual. Yeah. So rape can lead to that. Defilement, especially the young children that you are taking care of. Yeah. And I know probably you have cases like that. So if they are not managed well, by a specialist, somebody who's been trained, a clinical psychologist, a counselor, who's been taken through on how they can treat such conditions, then these are the cases that might even present with other mental disorders later in life. And we do see that. Yeah, so there is need for us, especially the cases that I know most of the children that you are taking care of would be have undergone the things that I've mentioned. Yeah. And therefore there is need to have somebody who is trained, who can talk to them, can take them through the process. It might take, I told you people are also different. There are people that can take a short time. There are those that you can work with them. You can imagine this is a child who has been defiled. In the unfortunate event, could also get HIV, might also get pregnant, So you can see a multiple problems that they are now presenting with. That if you don't mitigate, then they might present with mental. So these are patients that sometimes also have the anxiety disorder. They have panic. Panic disorder. So those are some of there are now quite a number of mental health disorders that we might not exhaust all of them. I think probably maybe in our subsequent discussions, we would be able to talk about that.
Thank you so much, Dr. You have actually mentioned a lot. And from this talk, we are going to get down to details of certain things that you have mentioned. It's going to be very useful to us and to the society, because a lot of these things you are talking about, not many people know them. And actually, unfortunately, not many people care to know about them. So this is why we want to demystify and bring it out so that people are able to speak about them. Because there are things that are affecting us, affecting the population, affecting the economy. So thank you so much for having us today. A common feature of many mental health disorders is distorted thinking. Talking openly and sharing can be immensely therapeutic. In the next episode, we bring you varied experiences. We encourage comments and opinions. Please subscribe, share, and click on the notification bell. God bless.